Hello, I'm Melissa Barnett, and we're going to talk about strategizing to maintain ocular surface homeostasis in soft contact lens wear. It's my distinct pleasure to work with many companies to grow our wonderful profession. I would like you to join me on Clearly KC, a podcast with the National Keratoconus Foundation for patients and practitioners. And let's continue the conversations on social media because it's such an exciting time in eye care. This is my recent visit to South Africa, and I thought that the elephant in bathing and drinking water was perfect when we're talking about homeostasis and contact lens wear. This is such a great time in the contact lens world. When we talk about the global contact lens market, it's valued at US dollars of 7.84 billion in 2020, but it's really expected to grow and expand. And we have this wonderful opportunity right now to help our patients with contact lenses. So it's going to grow from 8.58 billion in 2021 to 12.56 billion in 2028. So that's a compound annual growth rate of 5.6% in that forecast period. In North America alone, we also see an increased growth rate of 7.45% from 2021 to 2026. And there's a huge opportunity to fit contact lenses really in everyone. So kids to adults, and as ametropia increases, there's a great opportunity for contact lens wear to increase. And I would encourage you to offer contact lenses to all of your patients. So not just those who ask about contact lenses, but especially myopes, kids, presbyopes. You can offer multifocal lenses. And past the age of 45, when we have presbyopia, there's a huge opportunity to offer many different types of contact lenses, including soft contact lenses, hybrid lenses, corneal gas permeable, and scleral multifocal lenses. And we know that half of contact lens wearers drop out past age 45, and we really need to address the ocular surface to keep our patients in contact lenses. So here you can see with age, and even in the ages of the 30s, contact lens wear can drop off, and especially as we get into the 40s. And 93% of presbyopes were not actually wearing multifocal lenses at dropout. So when I'm lecturing to students are great fitting multifocal contact lenses because they follow the fitting guide. And we all need to learn from students to follow the fitting guide when we're fitting, say, soft multifocal lenses in order to keep our patients in contact lenses. The cost of contact lens dropout is significant. So the average annual revenue generated by a contact lens patient is $326. That's not only the contact lens fitting and materials, of course, it's the eye examination fee, glasses. Every contact lens wearer needs glasses, and also sunglasses. And then think of the medical visits that go along too. So it could be something like a dry eye follow-up, or addressing the meibomian gland dysfunction or the Demodex. All of these things are really important when we're fitting patients with contact lenses because we want to optimize the ocular surface. We want to optimize that tear film for tear film homeostasis, which is going to help with the vision and comfort and ocular health with contact lenses. The estimated lost revenue from each patient that actually drops out over a lifetime is $24,000. Just think of that. And I haven't even added the cost of all those happy patients who refer their friends and family to you for not only the contact lenses, but all of the medical eye services as well. So what is dropout? We talk a lot about dropout, and some people don't like that word dropout, or we can use retention, which is a little bit more positive. We want to keep our patients in contact lenses and retain them in contact lenses. But the definition of dropout is the percentage who have ever discontinued contact lenses or ever worn contact lenses, the percentage of people who are not wearing contact lenses or ever worn them, those that have discontinued in the last 2 years, and the percentage of new contact lens wearers who discontinued within the first year of being fit with contact lenses. And this number is actually higher than you would expect. And one thing that I've learned too is that handling, even of soft contact lenses, is fairly significant, even in that first year. Just think of the new patients that you fit with contact lenses, and there is a great opportunity to follow up with the patients, make sure that they can handle, apply, and remove the contact lenses. There are lots of questions that come up for new contact lens wearers, such as sleeping with contact lenses, or showering with contact lenses, or swimming with contact lenses. So I would encourage you, either you or your staff, to communicate with new wearers. You could do this in various ways. You can do it electronically, send a text message, a phone call, whatever works in your practice. But following up with the new wearers of contact lenses to make sure that they're happy with contact lenses. Also, another study showed that offering different technologies for those that are not happy in whatever contact lens is selected is also really important. So here are many different dropout studies. And at this time, looking at soft contact lenses, I think that we have the best contact lens technology that we've ever had. We have amazing materials, we have great designs, but looking at all of these studies, the dropout rate of contact lenses is still very high. Just think of if you're prescribing glasses and like 1 in 6 of your patients comes back and says, these glasses aren't working for me. I'm not going to wear those anymore. Those rates here are the same for contact lenses. So we want to optimize that ocular surface to keep our patients happy with their contact lenses. When patients come to me and ask, what type of contact lens do you recommend? And we'll talk about that a little bit more in this lecture today. I always like to ask their history. What have they tried before? What worked? What didn't work? When did they try it? Say it was a multifocal lens. Were they fit 10 years ago? Were they fit 2 years ago? What was it specifically that they didn't like, in order to offer new technology? And since we have many great new, say, soft contact lens technologies, we have a lot of lenses to choose from to help our patients. But we really want to optimize the surface of their eyes prior to fitting contact lenses. So this study was recently published in March of 2023, and this is talking about challenges to the new soft contact lens wearer and strategies for clinical management. I think this is a really helpful study. So not only looking at vision and comfort, looking at handling, inconvenience. We want to make sure that our patients find the contacts really convenient. I had a patient today who said, why do you recommend this soft daily replacement contact lens? And I told her, well, for me, I'd like to recommend it because it's the cleanest, healthiest lens for you. But for you, it's also the most convenient lens. So my patients tell me that it's very convenient to have a lens that's very comfortable, that they can replace on a daily basis, and recycle the lens too, that I'll talk about in a little bit. Cost is an issue. We do need to share the cost of not only the contact lens fitting, but also the materials with our patients. And in our practice, we're very upfront and straightforward that these are the costs. And this is this a reasonable cost? Is it not? I would also like to encourage you to think a little bit outside the box and have perhaps multiple prescriptions of contact lenses if cost is an issue. So for example, having a dual prescription, one of a 2-week or 1-month replacement soft contact lens, and another daily lens if cost is really an issue for that patient. So certain times a year, like during allergy times, wearing the daily replacement lens, or during travel or things like that. The CLEAR report from BCLA, this is just a really great part of that report on the effect of contact lens materials and designs on the anatomy and physiology of the eye. And this goes over all types of contact lenses on specifically meibomian glands. If you haven't read the CLEAR reports, please take a look at them. There's a great summary All of the reports have many different references on contact lenses. It is a fantastic resource. And here you can see all the different studies looking at meibomian glands and contact lens wear. Now, what are the benefits of contact lenses? There's so many benefits of contact lenses. Just to share a few. So freedom, we have improved peripheral vision. Think of athletes and the benefits of contact lenses. I always laugh when I go to yoga. I love yoga. And I see someone right next to me with their glasses on the edge of their mat. I think they're always going to step on their glasses, and I'm surprised when they don't. The benefit of peripheral vision is helpful for things way beyond sports, too. Think of all of the movement that we do in our day-to-day lives, the youthful appearance. And yes, we can do many things with contact lenses and help our patients see much better and feel better as well. Being glasses free is a great benefit. And for part-time wear. So remember that our patients that we fit with contact lenses, they don't have to wear them all day, every day. We have so many different types of contact lenses. Think of contact lenses that have special tints for sports. Think of contact lenses that are daily replacement for social. Think of different types of contact lenses that help relieve digital eye strain. We have many, many different options out there. And perhaps like shoes, we can offer different options for different things. You wouldn't wear high heels when you're out skiing, and you wouldn't wear snowshoes to a fancy event, right? Or on the beach. But we can offer contact lenses and just be creative to help our patients in really unique ways. Contact lenses are really helpful for your practice as well. So they fill a need and a want for a patient. So even if you talk to your patient about contact lenses and say they are maybe thinking about it or not sure if they're interested, I would recommend documenting that in your chart so that when you see the patient the next time and you can continue that conversation. Oh, yes, we talked about this contact lens. Would you be interested in that now? I love introducing my patients to new technologies, whether it's a contact lens or a pharmaceutical or whatever it might be. And so I document this in the chart. And sometimes I'll have my patients come back and ask me, oh, is that contact lens or is that new eye drop available that you told me about last year? And I love saying, yes, it is. Now it is available, and let's try it out. This really helps to improve patient retention and loyalty, helps increase referrals, it grows your practice, and of course, it increases revenue in your practice as well. Now, oftentimes my patients will ask me, are daily replacement contact lenses wasteful? I don't want to be fit with a daily lens because it's going to really impact the environment. And yes, I practice in Northern California, but I think that this conversation is really becoming more common everywhere. And we know that daily replacement contact lenses are actually not wasteful at all. Plastic is everywhere in our world today. 32% of plastic packaging ends up in the ocean every year, and 91% of plastic has never been recycled, which is just shocking to me. And here you can look at just contact lenses fit in general. So daily replacement, 43%. It varies a little bit. I would encourage you to track this in your practice. We do. And here you can see the 2-week of 19%, the 1 month at 34%, and just the different types of contact lenses fit. This is from Contact Lens Spectrum. So this is really surprising to me that 15 to 20% of contact lens wearers flush contact lenses down the sink or toilet. Please don't do that. An annual supply of daily replacement contact lenses produced 11.36 grams of dehydrated plastic waste, and that's compared to a 20-ounce water bottle, the equivalent weight of 1,586 dehydrated contact lenses. And you can share all of this information. There are many studies out there. There are articles specifically on contact lens recycling that I would encourage you to share in your practice. And of course, multiple companies have different options as well. So reusable contact lenses, any lens that is worn for more than one day, needs solution because we do need to clean and disinfect any contact lens that's worn for more than one day. And one single bottle, this might be one of my favorites, one single bottle of multi-purpose solution on average weight is equivalent to 2.5 years of daily replacement contact lenses. And a peroxide case is equal to more than 8 years of contact lenses. So for your patients who are concerned about this, you can share these facts that daily replacement contact lenses are really beneficial for the environment because we can replace the contact lens cases, solution, and cleaner bottles in our practice. We actually have boxes where we recycle everything. They're recycled in the plastic number 5 recycling, which has a high melting point. So let's go over different programs with different companies. So these are not all the recycling programs available, but there's some of them. Hopefully you know about them. So from Bausch & Lomb, the 1x1 and BioTrue Eye Care Recycling Program has recycled millions of units of contact lenses that's equivalent to the weight of approximately 31 elephants. See, it circles back to the elephants in the beginning. Cooper Vision has a first of its kind plastic neutrality initiative, which has expanded quite a bit to include additional countries in Europe and Latin America, and soon launch in different Asian countries as well. Alcon earned the Green Circle Zero Waste to Landfill certification for 3 ophthalmic drop-in solution manufacturing facilities. And Johnson & Johnson Vision also has a recycling program where all AccuView brand contact lenses are made with 100% renewable electricity. So I would encourage you to include recycling in your practices. And there are little boxes also that you can share with your patients, or you can inform your patients how to recycle their contact lenses, and not only the lenses, but the cases and solutions as well. But we know that contact lenses and dry eye, they go hand in hand. According to the DEWS report, it's that loss of homeostasis in which tear film instability and hyperosmolarity, ocular surface inflammation and damage, and neurosensory abnormalities all play etiological roles. And the contact lens on the tear film really separates that tear film into the pre and post lens tear film. So it increases thinning of the tear film, and with a soft contact lens, it increases evaporation of the tear film. So that's why we have patients who come in and say, my eyes are really dry when I wear my contact lenses. They're not as dry when I wear my glasses. And here you can see a really nice visual of the presence of a contact lens on the eye that can lead to dryness. And so that's why we want to optimize that ocular surface in order to prevent dry eye and ocular surface disease and retain or maintain our patients in contact lenses. So here you can see the pre and post lens layers where the bulk of the tear is behind the lens. This is a really nice image here too. You can see the pre-lens tear film and the outer lipid coating, and the post-lens tear film, which is the thin aqueous or mucin layer, where oxygen is transmitted to the cornea. And I do like to tell my patients about tear film homeostasis because they do understand that healthy balance of the tear film and the reasons why we want to optimize the tear film in order for them to wear contact lenses all day, every day, very comfortably, in order for them to wear contact lenses as many years as they want to during their lives and feel comfortable wearing contact lenses. Now, there are many, many different studies looking at contact lens dropout, but contact lens comfort is very important. So it's the number one reason for dropout is discomfort. 50% of successful wearers report dryness. 23% of the permanent dropout rate is primarily because of discomfort and dryness. There are many different risk factors for dry eye. Age is one, medications, screen time, we're all on digital devices, autoimmune conditions, and medications. So in order to retain moisture when we're fitting our patients with contact lenses, we do need to evaluate the activities that our patients have during the day. Many of our patients are doing many different things during the day. Think about all the things that you did today. Did you wake up? Did you go to the gym? Did you help out the kids? Were you on your computer or your phone or all of the above? And 78% of contact lens wearers report feelings of tired eyes. So when we're fitting our patients with contact lenses, we really want to evaluate the ocular surface. We want to evaluate the meibomian glands, the number of glands present. We want to evaluate the eyelids for telangiectasia. We actually want to press on the eyelids and evaluate for non-obvious meibomian gland dysfunction. Or if there is meibomian gland dysfunction, when we're pushing on the eyelids to see how the meibomian glands are expressed. Is it like a toothpaste appearance? Is it a baby oil sort of appearance? Is it an easy expression or not? And actually documenting that is quite helpful. And we know that meibomian gland dropout can be seen if you have technology, that's great. If you don't, you have a transilluminator, you can use that against the eyelid to evaluate for meibomian gland dropout. And here you can see a really insulated gland up top there. This is also coming from the CLEAR report, looking at the anatomy and physiology of the anterior eye and looking at the structure of the meibomian glands. I think this is great to bring us back to the importance of the meibomian glands and how the meibomian glands sit within the eyelid. And whenever I look at the gray line, I always think about makeup, and we want to avoid putting makeup on the gray line. I had a patient this week that had so much makeup on the gray line, and I was so worried about the meibomian glands. I do worry about meibomian gland dysfunction, especially for our kids, because we're all on digital devices so much, and kids will need their meibomian glands for many, many years to come. Now, we all know the beauty of the tear film, and we have the lipid layer that prevents tears from evaporating between blinks, the aqueous layer that makes up the bulk of the tear film, and the mucin layer that helps spread the tears across the surface of the eye. The tear film is really incredible and magical, and I want to get all of you to love the tear film because it has so many different components. So not only does it bathe and protect that ocular surface, it's the first refracting surface of the eye. It helps to reduce infection. It's absolutely quite amazing with all of its components. There are two primary forms of dry eye, and meibomian gland dysfunction is a major contributor to the evaporative etiology of dry eye. In fact, 86% of patients with dry eye disease have meibomian gland dysfunction, 14% are aqueous deficient, and there's a huge overlap where many have a mixed mechanism, even in those who have aqueous deficiency. The majority of dry eye disease does have an evaporative etiology. That's why meibomian gland dysfunction and the evaluation is so important, because it's a primary driver of evaporative dry eye. Meibomian gland dysfunction leads to a dysfunctional lipid layer and excessive evaporation, with this resulting cycle of desiccation stress, inflammation, and epithelial damage. So we have to really evaluate the meibomian glands in order to prevent evaporation, prevent that desiccation stress, and prevent tissue damage and inflammation as well. So when we're looking at the meibomian glands, we can see the normal eye here that houses approximately 30 meibomian glands in the upper lid and 25 in the lower lid, which run parallel along the length of the tarsal plate and open at an orifice at the eyelid margin. And here you can see the atrophy. So using either technology or a transilluminator, we can appreciate all the atrophy on the right-hand side of these meibomian glands. Now, Demodex is also something that we want to evaluate in our patients. So when we're evaluating the ocular surface, we do want to look at the lids and lashes, the cornea, the conjunctiva, use vital dye staining. But Demodex is really underdiagnosed and undertreated. Demodex is present in people of all age groups, and there are significant symptoms that overlap with other anterior segment conditions, and including dry eye, blepharitis. There are two types of Demodex. One type of mite is larger, and one type is smaller. Here you can see the cigar-shaped appearance on the eyelashes, and both adult mites have the same appearance, so you can actually see this on your patients and diagnose them with Demodex. So it's really easy to diagnose Demodex. You can have your patients either close their eyes or look down. I like for my patients to close their eyes because I can evaluate the eyelids and lashes. I can look for Demodex on those eyelashes. I can also evaluate for things like lag ophthalmos or incomplete eyelid closure as well. But I would encourage you to look for Demodex in all of your patients because it's more common than you'll think. Demodex blepharitis has different mechanisms. There's a mechanical mechanism, there's a bacterial mechanism, and also a chemical mechanism as well. Demodex is very common in our patients who wear contact lenses. This is one study that's looking at Demodex, and 90% of contact lens wearers actually have Demodex, and 65% of non-wearers. Demodex negatively impacts daily function, where people have trouble, say, driving at night, difficulty wearing makeup, constantly worrying about their eyelids and eyes, and feeling like there's a negative appearance of their eyes or eyelids to others. You can appreciate there are two different studies here, Saturn 1 and Saturn 2, that show the improvement in Demodex blepharitis, and we have a new treatment called XDEMVY that is specifically FDA approved for Demodex blepharitis. And here you can see the endpoints of mite eradication and erythema cure in our patients. So those patients that maybe you've treated for other things, but their symptoms are not getting better, I would encourage you to evaluate for Demodex blepharitis. There are very few adverse events associated with XDEMVY. All adverse events were mild or moderate. Next, we're going to talk about preparing the dry eye for contact lens wear. It's really important to educate our patients that dry eye and ocular surface disease are chronic conditions. So meibomian gland dysfunction, blepharitis, Demodex, dry eye disease, these are chronic conditions that are complex as well. I had a patient yesterday that I saw who was diagnosed with meibomian gland dysfunction outside of our clinic and was never told that it is a chronic condition. And even though it might take a little bit more time up front to explain the chronicity, I think it's really important to educate our patients so that they're motivated to do their treatment, because a lot of the treatment they're going to need to do at home. And the treatment does last weeks or months or years. Most of the treatment, it's not just one day or one time. It is going to take time. And it's also really important to see our patients back to make sure that our treatment plan is working for them. We also want to encourage our patients that these chronic conditions that many negatively affect the quality of life, they're long-term therapies, and it can be discouraging when a patient comes in, wants to be fit with contact lenses that day, and therapy is pushed off for a little bit because you want to optimize the ocular surface. But just think if you have a patient who you want to fit with a multifocal soft contact lens, We don't want to spin the wheels and try this lens and that lens and some other lens and a different lens when we can actually optimize the ocular surface, fit a lens, have good vision, good comfort, and good ocular health. So we want to educate our patients why contact lens wear has been delayed. We want to educate them that there is a light at the end of the tunnel in order to optimize their vision and comfort with their contact lenses, and the importance of keeping up with treatment in order for them to wear contact lenses successfully. There are many different types of contact lenses. We have different materials. We talked about daily replacement lenses. If we're fitting a reusable lens, we have different solutions, different care regimens. And I love Rao's study looking at the association between ocular surface sensation and quality of vision. So this actually shows that a patient who comes in who's saying my contact lenses are not comfortable, it could be because their vision is reduced, or a patient who comes in with good vision and they have poor comfort with their contact lenses, they might say that their vision is not as good as they want it to be. So vision and comfort are really important. This is the TFOS contact lens discomfort classification that came out in 2013, giving us strategies of what to do if there is discomfort in order to prevent contact lens dropout. So we can change the material, design, fit and wear, lens care. We can switch to a hydrogen peroxide solution, for example. We want to avoid overhead ceiling fans. We can switch to a daily replacement lens, add tear supplementation and dietary supplementation as well, and improve the environment. So these are all the things we want to do when we're evaluating our patients. We want to look at the cornea, the conjunctiva. I really like to use listening green. We want to check tear breakup time and evaluate the eyelids and lashes as well. Now, very exciting time because we have so many different options for success. So we've had Restasis and Xiidra and Cequa around now for a few years. Tyrvaya has been available and has been working really well, which is a nasal nose treatment for dry eye disease to stimulate that tear production. And I've been quite impressed with my contact lens wearing patients or those who wear makeup, how well Tyrvaya works. So a spray in the nose actually helps stimulate tear production. But very recently, we have two new products that are really helpful in different ways. So MyBo is an eye drop that is used for the signs and symptoms of dry eye disease. Now, when we talk about contact lens wearers, patients can apply contact lenses 30 minutes after the drop. The drop is a 4-time-a-day drop for dry eye disease for the signs and symptoms. We also have Xdemvy, which is a twice-a-day drop for 6 weeks for Demodex blepharitis. So super exciting time to help our patients. We also have multiple other packaged scrubs and wipes and foams and sprays and eye drops. We have lots and lots of things for our patients. I would encourage you to recommend or prescribe a specific product. And I would also encourage you to talk to your patients about makeup and specific products and specific ingredients in different makeup that they're using on the ocular surface. Now, makeup also includes, and I shouldn't only say makeup, but products just in general, includes sunscreens, lotions, and for men and women and everyone who's wearing these things. Now, digital device use is so common. We are all on screens. When I ask how many screens you're using, the majority have 3 or 4 or 6, and we don't blink as much. So we blink about 60% less when we're on digital devices. Digital device use goes hand in hand with dry eye. Need to blink a little bit more here. This was a study that looked at cognitive demand is linked to a decreased blink rate. So if we're actually working on something like a text document versus playing a video game, it will decrease our blink rate. And that is something to keep in mind when we're all on digital devices all day long. So we do need to educate on the 20-20-20 rule to prevent digital eye strain. We know that every 20 minutes, we should look 20 feet away for 20 seconds, take a break, and blink our eyes. Important to educate all of our patients on this. But we also want to change our positioning of looking at our digital devices. So we want to look downward about 10 degrees. An appropriate viewing distance is about 90 centimeters or 35 inches. Adding a desktop humidifier is quite helpful. We can prescribe or recommend blink exercises. There are different apps telling you how to blink as well. And there are many studies that show the benefit of humidifiers. There are little desktop humidifiers. There are humidifiers that can be used at nighttime, which are beneficial for our patients. So what's new and exciting in the contact lens world? Well, there's so much that is new and exciting. So let's talk about a few things. There are many different potential future uses of contact lenses. So we can diagnose different conditions, such as various biomarkers. There are many different options for ocular drug delivery with contact lenses to help in many different cases. We know that eye drops, the standard method for delivering ocular medications, that they have a low bioavailability of less than 5%. They're associated with a pulsatile delivery with a wide range of tissue concentrations. Adherence to therapy is quite important. So they can be costly. Eye drops can be costly and can be difficult to obtain. It might be hard to instill. If a patient, say, has a tremor or a shaky hand or loss of digits on their hand, and they're not super convenient as well. So when we're talking to our patients about different eye drops, we need to talk about how to instill eye drops correctly. And very few patients actually instill the drops correctly. It might be hard for patients. I'm sure that you have some patients that it's difficult for them actually to squeeze the drop as well to get it in the eye. And for, say, our patients with rheumatoid arthritis, it's hard to instill these drops. There's this huge excessive volume of eye drops. One dose is usually 20 to 50 microliters, and the precorneal space is only 7 microliters. So only 1 to 5% of the applied drug is absorbed into the eye. So drug delivery contact lenses really overcome these limitations of eye drops. They help extend that residence time on the ocular surface. They decrease that pulsatile delivery to a more controlled delivery and a local delivery even to the posterior segment, and also delivery to the anterior segment. So there are different methods of therapeutic contact lenses, and there's a soaking method, there's a molecular imprinting, and a nanoparticle laden lenses. There are other methods as well. But let's talk about some different contact lens options for drug delivery. So this lens is the first daily disposable contact lens for patients who experience itchy eyes due to allergic conjunctivitis. It is FDA approved in the United States, also in Japan and Canada, and has shown a lot of benefit of improved itching up to 12 hours in clinical trials. This is a different study looking at glaucoma and ocular hypertension. A really interesting thing about the SIGHT study looking at reducing intraocular pressure is that subjects were 73 to 84 years old. And these are subjects who were new to contact lens wear, and they were very successful in this trial. All patients demonstrated a decrease in intraocular pressure from baseline with this drug delivery contact lens, and there were very low rates of any adverse events or side effects. So this could be something that we could use for our patients with glaucoma. Looking at another trial, looking at glaucoma, latanoprost in this contact lens, looking in monkeys, showed a reduction in IOP over time with the contact lenses. We can use contact lenses for drug delivery after ocular surgery. So this is looking at different types of contact lenses that can deliver an anti-inflammatory, antibiotic, and pain-reducing drugs evenly over time. Just think about that. Cataract surgery, LASIK, for example, put a contact lens on that has a little cocktail of different drugs, and that will help the patient. And so they don't need to use eye drops after surgery. This is a dexamethasone releasing contact lens. These are all these different studies. There are a lot of studies on drug delivery contact lenses. And for this one specifically, it showed improvement, but more research is needed. It is a promising drug delivery system. Scleral lenses for drug delivery have been used for many years. A preservative-free antibiotic has been used in the lens bowl to treat corneal infiltrates, persistent epithelial defects. Scleral lenses have also been used to deliver anti-VEGF to treat corneal neovascularization and stem cells on a scleral lens carrier for management of a chemical burn in an animal model. When we're treating persistent epithelial defects, we do need to evaluate the patient every single day. There's a clear protocol on how to do this. One scleral lens for daytime use, one scleral lens for nighttime use, and there's a lot of benefits in these patients. So here you can see the management of PEDs with scleral lenses, very important to manage our patients and see them every day, including weekends. So the future is really exciting for drug delivery and contact lenses. We have smart materials. We can have light-mediated, temperature and enzyme-triggered releases of different contact lenses for drug delivery. And with that, I do want to thank you for your time and your attention, and I'm here to answer any questions that you might have. Hi, everyone. Thank you so much for attending this morning. It's great to have you all on, and thank you for the excellent questions. So we're going to cover some of the questions. The first question is, do you always talk to your patients about lens options, or do you also train staff to assist with this? Now, that is a great question. And if it depends on your practice and your situation. So I work with many different technicians, and some technicians and some who are contact lens technicians are very, very knowledgeable, and they're really good. And they actually talk to my patients about, say, daily replacement lenses even before I walk in the room, which is ideal. It's fantastic. Other technicians are not as versed as far as contact lenses go, so they don't really know how to have those conversations. But if you're in a practice that has staff, that's definitely the best way to do it, is to teach your staff, empower your staff with all the knowledge that they have to talk about different contact lenses and different contact lens options. I've seen some practices have talking points for contact lenses, and I think that's great to develop to share with all of your staff, including the front desk staff, so they are knowledgeable in different options for contact lenses. The next question, I think these questions this morning are just fantastic. The question is, how do you educate patients about not flushing contact lenses down the drain or toilet? Is there a cheat sheet? And I wonder how many patients know not to do that. And so you've sparked a project. Thank you already this morning. We need to create a cheat sheet. I actually had a patient this week who took out their contact lenses. I had a case on the counter and put their contact lenses in the sink right in front of me. And so I had that conversation. But you're exactly right that many patients don't know that contact lenses can be recycled in the number 5 recycling. They put contact lenses in the garbage, down the toilet, down the sink. And it's a really important point that we need to educate that daily replacement contact lenses are not a waste and the proper way of recycling them. Of course, you can give your patients a little box from all the major contact lens companies. They have a box that you can throw all your contact lenses in and then recycle them in that box, or whatever works for your patients. But thank you for the question, and we will create a sheet to share with all of you. The next question is, I've heard about taking 5-minute breaks for every 1 hour of digital time. Does this replace the 20-20-20 rule? Well, I think that I'm in real big support of the 20-20-20 rule. And I was lecturing live on Thursday night, and it was a mixed group of different types of physicians and talking about the tear film and the importance of tear film homeostasis and how the tear film is the first refracting surface. And when we blink, we create a good quality of vision. And I asked this group if they had heard of the 20-20-20 rule. So every 20 minutes, looking 20 feet away for 20 seconds and blinking the eyes. And many had not. So I think it would be great for everyone to be on the same page if possible. We all, myself included, need to take breaks when we're on digital devices. So I like the 20-20-20 rule. If you want to do something else, feel free to do it. But if we can get the word out to everyone who uses digital devices, which is most everyone out there, I think that would be great. The next question is for contact lens related dry eye issues. Do you have any recommendations for contact lenses? And gosh, this is wonderful. So I think it's very important to clean up the ocular surface first. So we want to evaluate the eyelids and lashes. We want to look at the cornea, the conjunctiva. We want to look at that tear film quality. We want to evaluate the meibomian glands. And I had a patient this week, it was amazing, where I talked here in the lecture about pushing on the lower lid to express the meibomian glands and look for non-obvious meibomian gland dysfunction. So the patient this week, I push on his lid and he had maybe 1+ MGD, not horrible. Pushed on his lid. It was like toothpaste, disgusting stuff coming out. It was absolutely awful. And he was interested in wearing contact lenses. And I thought, wow, he has horrific MGD, really want to clean that up prior to fitting contact lenses. So to answer the question for eye dryness, we want to address the blepharitis, the Demodex, the MGD. We want to stimulate that tear production, optimize the ocular surface. And then if possible, I would say, if we're talking soft lenses, a daily replacement lens, of course, scleral lenses are a great option for dry eyes because of that beautiful fluid reservoir that goes between the lens and the cornea. So there are so many different options to address eye dryness and still be very successful with contact lenses. Okay, the next question is, do you know when some of the therapeutic contact lenses will be approved? So the one FDA approved lens in this country, so the AccuView TheraVision for ocular allergy, that is the one lens that is being approved currently, but it's not being marketed right now at this point. And then as far as the other ones, I would say not this year, in 2023, but hopefully in 2024. Okay, well, thank you for those excellent questions. Thank you all for joining today. Have a wonderful weekend, and I look forward to seeing you soon. Take care.